Good morning, I am Angel Ramos. Today we were talking about the relationship of the infection of H. pylori and the deficiency of vitamin D. H. pylori is a gram-negative growth microaerophilic and spiral microorganism. These bacteria affect particularly its main reservoirs, gastric antrum in the stomach, and is transmitted through fecal-oral route. On the other hand, these bacteria cause different gastrointestinal diseases such as peptic ulcer disease, atrophic gastritis, adenocarcinoma, and lymphoma. There is a relationship between H. pylori and vitamin D in which this vitamin may reduce the risk to suffer H. pylori. Vitamin D is a fat-soluble vitamin that is naturally obtained from very few food sources and is available as direct dietary supplement. Also, it is produced endogenously when ultraviolet rays from the sunlight strike the skin and trigger vitamin D synthesis. It has a pleiotropic effect which has the potential for antimicrobial action, immunomodulatory, anti-inflammatory, anti-fibrotic properties, and controls directly or indirectly genes that are related to cell proliferation, differentiation, apoptosis, and angiogenesis.
Hi, so vitamin D, right? Vitamin D works on all nucleated cells, including dendritic cells, macrophages, B and T lymphocytes. This vitamin binds to these receptors and induces an antimicrobial peptides like catalysins and beta-defensins. These peptides have antimicrobial effects against gram-positive and gram-negative, killing them. A deficiency on vitamin D increases the chances of developing an infection, right? So we're not producing catalysins and we're not producing beta-defensins. Vitamin D deficiency is common on people over 60 years of age, putting them at risk of developing a H. pylori infection. These people are usually in homes, they're not going out in the sun, they're not eating well, so we can see how that connects. Studies have shown that around 50% of the world is vitamin D deficient, affecting especially women. Based on this information, we are going to focus in the elderly community, people over 60 years of age. To this paper, we are going to defend our statement, which is vitamin D deficiency can increase the risk of H. pylori infections.
Hi, my name is Kendra Rodriguez, and as you may already know from above, some details about vitamin D deficiency and Helicobacter pylori bacteria. And our main goal, which is to prove the relationship between vitamin D deficiency and the higher risk of developing H. pylori infections in patients older than 60 years old, which are more susceptible of GI tract pathologies such as gastric ulcers, as an example, increasing this way H. pylori appearance. The active form of vitamin D, that is 125 dihydroxyvitamin D, increases the catalyzing expression in H. pylori infected gastric cells. And also, beta-defensins are secreted from H. pylori infected gastric cells, provoking an antibacterial immune response. And certainly, without the active form of vitamin D, we can't fight the bacteria. On the other hand, experimental studies have shown that low vitamin D levels may lead to a disruption of the tight junctions integrity, mucosal damage, and increases the susceptibility to infections, leading to an inadequate immune response. For this reason, the host may fail to eliminate H. pylori that survives a low-acid gastric environment, which is more common to happen on the elderly. This can explain the increased prevalence of the infection observed among older patients. Also, epidemiological studies show that vitamin D deficiency increases the individual susceptibility to pathogen infections due to the role of vitamin D3 as an immunomodulator has been claimed, and vitamin D supplementation has been suggested as a preventive strategy for some infectious diseases. Indeed, the immune cell system vitamin D receptor is expressed by neutrophils, CD4 and CD8 lymphocytes, antigen presenting cells, and B lymphocytes, particularly when they are stimulated by pathogens. And note that are able to activate vitamin D3 and the vitamin D receptor that may lead to the inhibition of transcription of cytokine encoding genes.
Patients older than 60 years with vitamin D deficiency are also more susceptible to certain pathologies that affect their lifestyle due to senescence. Most of these patients has an increased risk to develop peptic ulcers, gastric adenocarcinoma, and other pathologies. Vitamin D is essential for bone health in adults, preventing osteomalacia, muscle weakness, and protecting against falls and low impact fractures. Is synthesized in the skin from ultraviolet irradiation from sunshine and to a small extent by absorption from food. However, these processes becomes less efficient with age. Unfortunately, people when they enter old age lose motor functions and soon their mobility is affected. Many people are bedridden in their respective homes or in care centers for the elderly, which makes it difficult to be exposed to the sun and receive the essential doses for vitamin D that are necessary for the proper functioning of the human body. This community, as time progresses, they lose their appetite, and as a consequence, they have less intake of the supplement. This causes only a deficiency, but a reduction in the vital effects for the homeostasis of the organism.
Deficiency in vitamin D can be also associated with several diseases, but the main ones include several kinds of malignant tumors. Remember, the vitamin D binding protein is a carrier that combines with vitamin D and is metabolized to transport it inside the cell. Another trigger for the deficiency can be cardiovascular disease. This can be explained as the low levels of vitamin D lead to the activation and releasing of pro-inflammatory cytokines. In the case of osteoporosis, it was reported that vitamin D concentration in H. pylori infection is different in several disease status. H. pylori may lead to decreased bone mineral density and predispose to osteoporosis. Lastly, studies have demonstrated that individuals with vitamin D deficiency are at higher risk of metabolic syndrome like diabetes mellitus. So, to conclude, it is evident that vitamin D deficiency in older patients increase the risk of developing an H. pylori infection. This due to the impairment of immune response against infections, mucosal damage, and other clinical presentations in which lack of vitamin D may cause low gastric environment and other conditions which elderly community may develop. For this reason, we are certain that vitamin D deficiency makes elderly patients more susceptible to H. pylori. As medical students and future physicians, we think that the scientific studies should be increased in this field, so we encourage research to expand the scientific literature, especially in geographical areas. There is a lack of recent studies because this relation was recently discovered as a point of interest.